A 29-year-old woman comes to the physician because of a 5-day history of odorous, thin, gray vaginal discharge. She is sexually active with one partner and uses condoms inconsistently. She has no dysuria, pelvic pain, or fever. Pelvic examination shows a homogeneous gray discharge coating the vaginal walls. Addition of potassium hydroxide to the discharge produces an intensified amine odor. Microscopic examination shows epithelial cells with bacteria adherent to the surface. The most appropriate pharmacologic therapy for this patient acts through which of the following mechanisms? Choice A, disruption of the cell wall. Choice B, disruption of DNA structure and function. Choice C, inhibition of 50S subunit. Choice D, inhibition of dihydrofolate reductase. Choice E, inhibition of DNA gyrase, also known as topoisomerase 2. Choice F, dissolution of keratin. 5 seconds and I'll answer the question. So these micropharm questions are always annoying because there's so much we could talk about. But let's try our best to keep this pointed. So this question is textbook bacterial vaginosis, also known as Gardnerella vaginalis infection. Treatment on USMLE is metronidazole. Metronidazole forms free radicals and then causes damage to DNA. Choice B is the correct answer. It can be written like this on USMLE, disruption of DNA structure and function. It can be written as formation of free radicals. That's really the big takeaway I want you to have here, really, is just be careful of the wording they use to describe metronidazole. Sometimes it can be tricky with that. So before we go into the other answer choices, let's just talk about metronidazole real quick. On step 1, the other big uses you want to look out for are Giardia lamblia and Trichomonas vaginalis. Trichomonas won't be too different from this vignette. You'll have vaginal discharge, itching, painful urination maybe. Typically, if they want to point you towards Trichomonas vaginalis, they'll give you the wet mount, usually showing the trophozoites of Trichomonas. They look kind of like horseshoe crabs, with a bunch of strings coming out because of the flagella. Giardia, on the other hand, also kind of looks like Trichomonas under the microscope, but in contrast, a lot of Giardia questions will not give you a wet mount. They might tell you that patient went camping and he drank water from a stream or something. Anything where you think they might be exposed to contaminated water. And then the symptoms will be something that suggests fatty stools. So they'll say stools that float, foul-smelling stools, because they want to give you this so that you can be sure to differentiate it from cholera, which is just tons and tons of watery diarrhea, or sometimes Yersinia enterocolitica, which causes bloody stools. Anyway, again, big ones you gotta look out for metronidazole. Obviously, Gardnerella vaginalis, like in this question, Giardia for GI infections, and Trichomonas vaginalis for another STD. It can also be used for a number of anaerobes like Bacteroides. It is notably not used anymore for Clostridium difficile, which causes pseudomembranous colitis, which is usually patient was on a course of antibiotics and then they start having really bad, foul-smelling diarrhea. Clostridium difficile is now treated with oral vancomycin, though obviously if you get a question about pseudomembranous colitis and vancomycin is not one of the answer choices, you should probably still pick metronidazole. Like I said, we could spend all day talking about all kinds of micro here, but let's try to move on and talk about the other answer choices here. Choice A, disruption of the cell wall. This could refer to so many different drugs. Obviously, this refers to beta-lactams. If we're just restricting ourselves to STDs, it's worth remembering that Treponema pallidum, or syphilis, is treated with penicillin, whereas Neisseria gonorrhoeae, or gonorrhea, is treated with ceftriaxone. Choice C, inhibition of 50S subunit. This can refer to macrolides, clindamycin, linezolid. Very important that macrolides like azithromycin can be used for atypical pneumonias like mycoplasma. Clindamycin can be used for anaerobes like in aspiration pneumonia or lung abscesses. Linezolid barely exists on USMLE as far as I know, but it can be used for MRSA and VRE. Choice D, inhibition of dihydrofolate reductase. You would think of TMP-SMX and pyrimethamine sulfdiazine. TMP-SMX can be used for PJP pneumonia. Pyrimethamine sulfdiazine, use it for toxoplasma. And of course, when you hear inhibition of dihydrofolate reductase, you also think of methotrexate. Not an antibiotic, but worth bringing up. Choice E, inhibition of DNA gyrase. That's mostly fluoroquinolones. It's used for gram-negative rods in the urinary and gastrointestinal tracts. So like prostatitis, pyelonephritis, that sort of thing. It's used for otitis externa. Can be used for anthrax, but I don't think that ever comes up. Choice F, dissolution of keratin. This is just a weird distractor I threw in here. I was referring to salicylic acid with this. You can use it to treat HPV warts. Alright, I know that was a lot. Let's bring it back. Main learning point for this question is metronidazole. It's used to treat bacterial vaginosis, like in this question. It's used to treat Giardia lamblia. It's used to treat Trichomonas vaginalis. And you need to know that it forms free radicals that damages DNA structure and function. I hope you found this video helpful. I'll see you in the next one.